purposes of describing what's in the legislation, let's just be clear about what's in the legislation. And so it does not. And I think overall, the goal for universal coverage, I think it could be met, obviously, with a single payer plan. That, again, is not where we are. This plan is projected to cover 97% of the American public. Probably about of the public. Probably about 3% are people who, for whatever reason, opt out or away or are still seeking emergency room care. That's a far cry from where we are now. And so getting to 97% gets us really to universal coverage. And I know you've been waiting for a long time. I've seen that.
Lenny Backlars. I'm a physician assistant. I've been practicing cardiac surgery for about 23 years.
You were in Oxon Hill.
I did.
Yes,
I want to get you to answer the question.
I remember.
I read most of the bill. It's a very unpleasant thing to read. My question is, Medicare has been reducing reimbursement for years, progressively over 10 years. Now we have never events in which they do not cover sternal wound infections after surgery. Now, how are you going to cover all these people? I have two questions. How are you going to cover all these people when you're going to cut Medicare by $500 billion, which is the projection? Step two, the president wants to stop the Medicare Advantage program. Medicare has hundreds of billions of dollars unfunded liability, which requires our Medicare recipients to carry a co-payer to make their ends meet. And he wants to abolish that at $17 billion. So how are you going to not ration care by reducing reimbursement? In the bill, the never events will continue, and there will be further cuts in Medicare.
Well,
so step one, how are you going to do that?
Let me just say, first of all, I think it's actually really important in these conversations, and especially when we're speaking to our seniors who are the beneficiaries of Medicare. We are not reducing your Medicare benefits. It's not happening. It is not happening. And that in fact, we actually, although there are $500 billion in savings identified in Medicare from the things that I described earlier, $340 billion of that is actually put back into the Medicare system. That's the legislation. Now, we can probably have an argument about this, but I'm not going to do that with you, because what I'm going to do is you ask your question, and I'm going to tell you that in very plain language, just so that everyone gets it and understands it, we are not reducing your Medicare. Over 44 years, we're going to learn a lot more about our health care, and there will be many pushes and pulls and tweaks over the course of years, not just because we want to be just efficient doobies, but because it's important to get that right for health care for all Americans. So thank you for the work that you do.
Congresswoman, I'm Shakil Hamid from Potomac, Maryland. Very simple question. If the federally funded health care does pass, will you opt out of your generous congressional plan and enroll in the public sector one?
Well, that's always a question. That's always a question. Let me tell you, I mean, I've heard this question a lot about, whether members of Congress will opt out of our health care plan. Members of Congress are part of the federal health care program, and I think it's actually important that we treat employers who currently provide health care in a way that we don't make that we're not pushing people over to move cost up on the exchange system. The exchange has been limited for a reason. It's limited to small employers. It's limit. Let me just finish. Okay. I'm actually not even going to talk anymore unless I can do it without the hissing. Okay. So the federal employer is then treated like other employers. Now, when I had health care provided by a private employer that paid premium service, I actually paid a lot less for my health care than I do currently. If I think that there was an amendment to enable federal employees to opt in into the exchange. I personally don't have a problem with that. Because I think that the exchange really is going to be the kind of marketplace that we've described, where you will have multiple private insurers and the public option to choose from. But ideally, we want to make sure that employers who currently provide health care coverage continue to provide health care coverage. I think for those of you who are afraid of the language of a government takeover of health care, that actually the last thing that you would want would be for private employers to say we're not providing health care insurance anymore. And so that suggestion is actually counterintuitive to the goal of trying to ensure that we have both a marketplace and we have the public insurance option.
My name is David Henderdyne. I live in Clarksburg. Thank you for hosting this town hall meeting tonight. Everything that you said sounds great in theory. My question is, as I look at the three bills and compare those and analyze what's there, they seem to be very weak in substance and really lack a lot of details and appear to give room for government control as the system continues. My question is, everything that you've said tonight sounds wonderful, as I said, in theory. Ronald Reagan said that government is not the solution, government is the problem.
We're actually not going to have that, please. Can we actually let him finish his question? Thank you.
Thank you. I've been very courteous.
Thank you.
My question is, as much as I would like to trust my government elected officials, I don't. My question to you, Congressman, is, why should I trust you? And why should I trust my government elected officials? And what can you do to restore that trust in government?
Good question. Thank you. First of all, let me just say we actually share competing views about the role of government, and I think that that's true in this room. There are some people who share the view. There are some in this room who probably share the view that no government, no way, and nothing. But there are others of us who share the view that government has a role and responsibility in our lives, and it's up to us through our elected officials to help define what the parameters of that responsibility are. And so I am of the latter. Then in terms of how do you trust me? If you're speaking about me, Donna Edwards, representing the 4th Congressional District, I understand that as an elected member of Congress, I have to earn your trust. Just like I understood a year and a half ago when I wasn't an elected member of Congress, that the person who was holding office had to earn my trust as well. That's the relationship that we have as constituents with our elected officials. The same is true of the relationship that you have and that we all have with the President of the United States, that we have with our governor. And so I'm just going to work all the time to try to earn your trust. And you get to decide at the end of the day, and sometimes that's on election day and other times it's in between, about whether I've met the mark or not. And I'm happy to engage in that over the course of the remainder of my term to make sure that I'm earning your trust. Part of the way that we do that is that we're able to gather like this in a room full of people who come from so many different places to try to express our viewpoint about our healthcare system and the range of other issues that confront us. That's part of the trust gaining mechanism as well, because I don't just want to hear from people who agree with me. At the end of that conversation, we may have to agree to disagree, but on something as important as healthcare, it's at least important for us to engage.